This is Jane. One day she found a lump in her breast. From this point, Jane was diagnosed with breast cancer and underwent surgery within the next week. Being 43 and premenopausal meant Jane underwent more aggressive treatments such as a double mastectomy and chemotherapy treatment. Throughout this, Jane is managing 2 kids, taking them to school, whilst dealing with fatigue, managing appointments and putting her job on hold. After treatment, Jane will receive injections for the next 5 to 10 years, which will suppress her estrogen and put her into early menopause within days or weeks. If dealing with the diagnosis, managing appointments, family and side effects wasn't enough, Jane also gains 10 kilos in the year since diagnosis. In the months after treatment finishes, the fatigue subsides, the appointments become less frequent, and life becomes semi-normal again. But the weight remains and Jane finds this distressing. Because of this weight gain, Jane is also at a higher risk of the cancer reoccurring and developing comorbidities such as cardiovascular disease. This is the reality for the majority of the 3,500 premenopausal Australian women diagnosed with breast cancer each year. Despite the large amount of research into how to provide weight management support, premenopausal women are frequently excluded. We see with traditional weight management programs that they're effective for older women, but not for younger women. And it's unclear if this is due to the rapid menopause that younger women go through, or perhaps competing priorities such as full-time work and young children to care for. This is where my PhD comes in. I sought to understand how to provide effective weight management support for younger women diagnosed with breast cancer. My review of weight loss studies in non-breast cancer populations showed this difference in weight loss between pre- and postmenopausal women is unique to women with breast cancer. To understand this more, I conducted interviews with younger women with breast cancer to understand their challenges with diet, exercise and weight following diagnosis. I used this information to co-design a more intensive weight management intervention tailored to the lives of these women. Results from this trial showed that women achieved a significant amount of weight loss. When asking women what was effective, the convenience of the diet and help implementing this into their lives was key. Now, let's think back to Jane. Jane has had to deal with a breast cancer diagnosis, treatment, losing her hair, both breasts, weight gain and early menopause. On top of this, before joining my study, Jane was told she wasn't eligible for a breast reconstruction because of the weight she gained as a side effect of treatment. How would you feel about this? We owe it to these women to do better at understanding how to provide weight management support. After participating in my trial, Jane is now eligible to receive the breast reconstruction she desperately wants to remove this constant reminder of her breast cancer. Thank you.